Good evening, everyone, and welcome to today's session. We were all eager. What is going to be the NEET PG exam? Is it going to be on January dot or not? COVID is the king of everyone's destination now. So COVID ultimately decided, let the exam be postponed, and we have no other option. But let us look at the brighter side of the story, that probably it is another God-given opportunity for us to regain our energy and prepare much more emphatically, enthusiastically, and with confidence. Whether the exam happened to be on January 5th or whether it happens to be on March 5th, it really doesn't matter. Still, Dr. Murali Bharadwaz is always there to sit along with you and prepare for the NEET PG exam. So welcome back. I'm very happy to see 18 online classmates. Please invite your friends. We will study together this extra time, morning, afternoon, evening, wherever, whenever we get the chance. We will try to have online live interactive session so that as many number of high yield topics we will try to finish and go for the exam. So I hope you all will join me in this journey. Don't forget to click on the bell sign so that the moment I start a broadcast, whether it is midnight or early morning or late afternoon, doesn't matter, you get a notification. And be part of our WhatsApp group so that you get an opportunity to join the live online session on the YouTube. So let's make the great beginning, Doctor. Good to see Swapnil alone, Ajita, Rati, Shivani, and many more who are all online. Can you please punch whether the voice is loud and clear for all of you? Yes. So always our preparation every time we re-emerge starts with anatomy. Keep punching the answers so that you are very much alive along with me. Let me go to the So let's start the game. In anatomy, there are totally 56 high yield topics, and there are 1,000 points that you need to master to crack the subject of anatomy. So let's take up topic after topic and try to finish. Now, hyoid bone. Who want to give me a challenging correct answer? Keep punching into the chat window. Hyoid bone is at which vertebral level? This is one of the favorite questions. You should remember, it is at the level of the C3 is what I want to underscore to all of you. Shivaji, Tony was clean bowled. Swapnil was saying C3. Even Sayeda also was betting on C3. Very good. So, doctor, this is purely an area of by-hearting and mugging. That is a sad part. C3 is hyoid bone. It is also the point of bifurcation of the common carotid artery into internal and external carotid artery. C4 is the superior border of thyroid cartilage. C6, cricoid cartilage. C6 is also the landmark for something else. The larynx ends, trachea begins at the level of the C6. और एक बार बच्चों मेरे साथ रिविजन करो. This does not require any brains. Only thing is you need to get into the habit of doing revision with a classmate. And you have Dr. Murali Bharadwaz, let me assure you, every day, every minute available to you as a classmate. मेरे साथ बोलो, larynx ends, trachea begins. C6, please don't forget. Pharynx end, esophagus begins. C6. Inferior thyroid artery crosses the carotid sheath. C6. Then inferior laryngeal nerve enters into the larynx. The inferior laryngeal nerve is very important nerve in the nerve supply of the larynx. You should know everything, anything about the vocal cords, nerve supply of the larynx, we will discuss. And the vertebral artery enters the transverse foramen of C6 at the level of the C6. So that is the significance of the C6 is what you need to remember. Now, what is the importance of C7? C7 is a favorite question. Vertebra prominence is a very prominent landmark. Isthmus of thyroid gland. Tomorrow, some of you are going to be top surgeons doing thyroidectomy, tracheostomy, etc. So, isthmus of thyroid gland, C7. And the thoracic duct reaches the highest, greatest height at C7. Then what is the importance of T1? Whenever I'm so happy to see 30 online classmates. हम बहुत खुश हैं. So please invite your friends also. I am jobless. You are jobless. We are all jobless together. So let us study every day and become the toppers in the NEET PG. A lot of times some students say, ये क्या है सर? खाली दूसरों का मोबाइल ऐप देखे तो हर एक सब्जेक्ट का एक टीचर होता है, हर एक चैप्टर का एक टीचर होता है. But you are the only speaker for all the 19 subjects. I tell always one thing. A lot of times for a student to synchronize with the teacher, it is easy to synchronize with one type of teacher. Luckily, a lot of times good teachers are all easy to tolerate. But when you have 19 different teachers, it's good and glamorous, but it may not fit everyone, right? And I also say that, what is the role of a teacher? Teacher is also a student. At what level trachea bifurcates? Should anyone teach us? Not required. Where will pharynx end and esophagus begin? Should anyone teach us? Not required. But the role of the teacher is, वो भी हमारे साथ बैठ गया और हमारे साथ पढ़ाई कर रहे, हमको भी पढ़ाई करने का इंस्पिरेशन मिलता है. That is the only purpose of teacher, nothing super duper about it. So that is the reason I always tell, when a single student is preparing for all 19 subjects, why not a single teacher can become a student and do a revision of all 19 subjects. So sometimes it will be slightly boring to have only Dr. Murali Bharadwaz, but that's the way I can be able to give the best to you all, right? Now, T1 to T2, superior angle of scapula. T2, jugular notch. T4 is the sternal angle of Lewis. This is important. What are all the anatomical landmarks at the level of the T4 is the favorite question of the examiner. Once more, मेरे प्यारे साथियों, please don't forget. Ascending aorta ends. T4. Arch of aorta begins and also ends. T4. T4. Good to see Muhammad Umar. Sir, so happy to see you after a break. Absolutely. Absolutely. I'm also very happy all of you have come to the session. I was delivering session to 5, 6, 7 recently. I thought maybe because I was not maintaining regularity, students ko bhi kahin aur chale jayega. So please do come. Please tell your friends also. Don't forget to download the Incus quiz app. Incus quiz app. In that, there are about 20,000 hot MCQs organized as 1,000 quiz tournaments of 20 questions each, topic-wise. Once you answer, you will be knowing how others are performing in the live session in Incus quiz app. After that, you can be able to come back to the history where you have the explanatory answers for the questions. You can also add an audio, video, comment of your own for every question. You can bookmark the questions in the last moment. And we are introducing a very interesting feature in the Incus quiz app called My Rights, My Wrongs. All questions which you played that went right and wrong will be shown like a stamp. And you can always do a quick revision of your wrong questions before exam. So, lot of features in Incus quiz app. Please don't forget. Please do download the app. Good to see Aditya Raj and Mahesh Saini, many more. So, doctor, what is the importance of sternal angle? The trachea ends and the major bronchi begin. That is at the level of the T4. So why this landmark is important? Whenever you pass an endotracheal tube, some of the residents anxiously will push it. But if you push it, it will pass below the level of the T4. If it enters into one of the major bronchus, that can lead to atelectasis of lung. Post-endotracheal tube intubation. That's the reason you have to be very sure of this landmark. T4, trachea ends, primary bronchi begins. T5 to T9, you have the body of the sternum, and T5 to T9, you have the body of the sternum. Behind that, you have the heart. The vertical anatomical landmarks. T7 is the inferior angle of the scapula. T8, IVC pass through the diaphragm. T9 is the Xiphi-sternal junction. T9 to L3, you have all the coastal slips of the diaphragm. T10 esophagus enters through the diaphragm. Voice of America, you know very well. T8 is vena cava. T10 is esophagus. T12 is aorta enters through the diaphragm. Thoracic duct through the diaphragm. Esophagus vein through the diaphragm is what you need to remember. Now, another favorite MCQ. Any entrance you write, whether India, America, Pakistan, Bangladesh, anywhere, L1 transpyloric plane. What is its importance? It's called transpyloric. Usme kya badi baat hai? Pylorus of the stomach, immediately above and right to the midline. Duodenojejunal flexure to the left of the midline. Pancreas and the origin of superior mesenteric artery, transpyloric plane. Hilum of the kidney is hilum, L1, transpyloric plane. Celiac artery originates just above the renal artery, and so L1. Then L2. L2 is thoracic that begins, esophagus and hemiesophagus also begin. So that is the importance of transpyloric plane. Good to see Aparna, Krishnan, Aditya, Raj, and many more. Now, doctor, L4, L5 is iliac crest. It's very important to give lumbar puncture. You will feel the iliac crest. So L4 to L5. S2 is posterior superior iliac spine. S3 is the posterior inferior superior iliac spine. And L4, L5 is the place where aorta bifurcates into common iliac arteries. And inferior vena cava is formed by the merger of the common iliac veins. That's the reason L4, L5. And the end of the dural sac happens at the level of the S2 is what you need to remember. Why S3 should be remembered? The pelvic colon ends and the rectum begins. Because tomorrow some of you are going to be the top surgeons who are operating on the colon carcinoma. So you should know pelvic colon ends, rectum begins at the level of the S3. So that is the story, doctor. Don't worry about about whatever that is there in the PowerPoint slides. It is there in every damn book. हर एक कोचिंग बुक में मिल जाएगा. मगर what is important? इधर के किताब में बैठना है मेरे भाई. It should sit in your mind. You should practice it with your friends. It should get into your 200 pages notebook. That is important. So please download the Incus quiz app. So we will try to convert this set of questions into a quiz tournament and create a tournament in Incus quiz app. At least after the class is over, go to the Incus quiz app, go to the NEET PG, and you will find the upcoming tournament. Play the tournament. Go to the history. There you can review each of the questions that we are discussing now. And if you click on the question, there you can enter a audio, video, comment, etc. And all these explanatory slides, we make it available in the Incus quiz app in the history of the tournament. So the cardiac end of the stomach lies at which rib? It lies at 7th rib. Inferior angle of scapula, T7. Renal artery originates at superior border of the L1. So, like a parrot in the tomorrow's exam, you should answer all these questions. So the renal artery arises from the aorta just inferior to the superior mesenteric artery, which basically originates at L1, L2 vertebral disc is what you need to remember. The lower angle of the scapula is at which level? T7. T7 is the lower angle of the scapula. And the spine of the scapula, you should remember T3. Very good. Good to see Muhammad, Umar, Anjana, Krishnan. Keep punching your answers. Keep any other points that come to your mind. That's how the preparation should go on. So what is that structure related to the arch of aorta? Tracheal bifurcation. So you should once more be very sure to revise this very important landmark. T2 is jugular notch. T3 is the base of the scapular spine. T4 is the sternal angle, second costal cartilage, tracheal bifurcation, upper end of the ascending aorta, beginning of the descending aorta, arch of the esophagus vein to enter into the SVC. T7, inferior angle of scapula. T8, IVC. T9, xiphoid process. T10 is esophagus. T12 is aortic hiatus, is what you need to remember. The highest point of iliac crest. Chalo bhaiya. Please answer this question. Punch your answer. Let me check how much you are awake in answering these questions. Come on. The highest point of iliac crest is at which level? Punch, punch, punch into the chat window. Punch into the chat window. The highest point of iliac crest is at which level? Very good. Pravalika is proposing L3 to L4. Absolutely. Satyendra Singh, Sayeda, Rajesh Babu, clean bold. So, doctor, please don't forget. C7 is the vertebra prominence. T3, spinous process of the scapula. Iliac crest, जो होता है, you should remember L4 is what I want to underscore to all of you. Deep cardiac plexus. Where is it present? Typically, when the trachea bifurcates, you have the deep cardiac plexus which is located. So cardiac plexus can be superficial plexus below the aortic arch, or it can be a deep anterior to the bifurcation of the trachea. So what are the other important visceral plexus, Dr. Pulmonary plexus, celiac plexus, abdominal aortic plexus, hypogastric plexus, which can be superior and inferior hypogastric plexus. So what is this deep part of the cardiac plexus? It is anterior to the tracheal bifurcation. It has the cardiac branches of the cervical and the upper thoracic sympathetic ganglia. And it also has got the vagus, recurrent laryngeal nerves, etc. Now, doctor, mid-inguinal point, what is the position? Typically between anterior superior iliac spine and the pubic symphysis, the midpoint is basically called the mid-inguinal point. So, doc, you have the axis, anterior superior iliac spine, pubic tubercle, inguinal ligament, the midpoint. So, what is the relationship, doctor? You have the nerve, most lateral, artery in the middle, vein, medial, and most medial is the lymph. So you can remember navel starting from lateral to medial is what you have to ultimately remember. So how does internal jugular vein, how is it formed? It is joining 2 points between where and where? The medial end of the clavicle to the point on the neck, medial to the lobule of the ear, is basically the internal jugular vein. So you can remember, you have medial to the ear lobule, to the medial end of the clavicle. If you traverse that route, that is the internal jugular vein. Tomorrow, as the residents, you all will be doing the puncture of the jugular vein to pass the catheter to calculate the central venous pressure, etc., etc. So you should know what is the way the internal jugular vein is passing. So, how do you identify common carotid artery? It is the upper part of the sternal end of the clavicle to the point midway between the tip of the mastoid and the angle of the mandible. So this is the angle of the mandible, and here you have the tip of the mastoid. So you need to take a midway point. So if you shoot a line, that is the line of common carotid artery is what you have to remember. So this is how the common carotid artery bifurcates into external and internal carotid artery. Similarly, how do you identify external carotid artery? From the side of the cricoid cartilage to the front of the external acoustic meatus, if you happen to traverse, that is how the external carotid artery will be passing. So all these landmarks are very important tomorrow when you are doing the catheterization, is what you have to remember. Absolutely. Anjana Krishnan rightly says, van from medial to lateral. The tympanic note of percussion in the top space in the chest wall. What is the underlying structure which is causing that tung, tung, tympanic note, doctor? Tympanic note. Please punch your answers. Mahesh Saini is saying, sir, please what? Bharati is proposing fundus of the stomach. Fundus of the stomach. Mahesh Saini is asking, sir, scrubbing is which type of sterilization method? Wow. I have to check that. But still, please be part of our WhatsApp study group. हम बहुत मजे में बहुत सारे क्वेश्चंस डिस्कस करेंगे, right? Also, you can download the Incus quiz app, play the tournaments, go to the history, and inside the quiz questions, you can also post comments and any doubts. The whole community of students will answer them, right? So, yeah. God loves you, Thomas says, happy to see you, sir. Same feeling here. So every day, every moment I get an opportunity, I come online. We have about an hour of discussion. And totally, we have about 200 hours. We revise crash course, all the 20 subjects, right? All the 19 subjects. My major intention is to stimulate you to read. You know, there is abundance of study material in the market. But what is important is WhatsApp number, don't worry. Please call 9000-868-356 right away. And you will get an invitation to join the WhatsApp group of Online MBBS. Yeah, Incus quiz app. Please don't forget. Incus quiz app. I will once more Yeah. So once you go to the Google Play Store, if you go to the Google Play Store, you click Incus, then you get this panda, that is the Incus. So once you click on the Incus, quiz play hourly multiplayer live quiz. So please download this app and you can play. There are totally 20,000 questions in the form of 1,000 quiz tournaments. And also there is a web app of this Incus, not only the Android mobile app. So here, once you come to this place called NEET PG exam, you will be able to see all the upcoming tournaments. For example, tonight there is at 10 o'clock a image-based MCQ quiz tournament. Then you have the completed tournaments whose time is already over. So you have almost 20,000 questions organized in the form of 20 MCQs is one tournament. So you have medicine, NEET PG, mock test, surgery, orthopedics, etc., etc. You have all the quiz tournaments. These are all 20 MCQ quiz tournaments. So just you can, that means the time is already over. So what you can do is, still you can play, you can go to the autoplay. So already whoever has played, you can be able to play retrospectively with all those players. As such, they are live competing you, so that you will be knowing how many are answering what. And once that is being played, you will get your scores, everything. So once you finish the quiz tournament, if you go to this place called history, here you have the history. Once you click on the history, you can be able to see all the tournaments that you have already played. For example, this is a surgery quiz, which was conducted on 24th October. So once you go to the review, then you can see all the questions that have been asked. You can be able to bookmark these questions for the last moment revision. You can go into inside of the question. Then you can see what is the correct answer, how many answered A, B, C, D. And the beauty part is you can be able to add a comment. For example, this is a question on ERCP. So you can say ERCP is important for, let us say, stones, right? So once you submit, that the comment become posted. Once you submit, also you can be able to choose an audio, video comment you can add. You can add your own extra comments, everything you can be able to do. Okay. Sir, do we get alerts of upcoming quizzes or we have to keep checking the app? Not really required, Asra Khan. You keep getting notification of the upcoming quiz tournaments automatically. Every time a new quiz is being published, you get the notification. Not only that, in a given quiz, whenever somebody posts a comment, if you already played that quiz, then also you'll get a notification and you go back and see what are the extra comments. That way, it becomes a community together, playing together, and it becomes rich. So whatever that we are discussing now, I'm going to make it all these questions. I will also create a quiz tournament for these questions. And I will put all these notes that I am showing here when you are reviewing these questions after playing tournament. So that way you also can give a voice comment, audio comment, video comment, everything. You can write handwritten notes and clip it so that your classmates can see it and they can like it. They can also add comments. So that way learning become interesting when you are challenged in the form of quiz tournaments. So already there are 20,000 questions with explanatory answers waiting for you to play, know how much you are going right and wrong, bookmark for the last moment revision, everything for a small price, 600 rupees per month. Just for 600 rupees per month. The cheapest that you can ask in the entire world, right? So that's the story. Now, doctor, the tympanic note on percussion of the drop space is because of the fundus of stomach. So here you have a semilunar shaped drop space is what you have to remember. Constrictions of esophagus. Where are they located? Keep punching the answers, doctor, along with me so that you are keeping yourself very active. And I promise you, early morning, afternoon, evening, late night, whenever I am getting time, I'll come online and spend a couple of hours with you and do the revision so that you are fully motivated across the day. And also keep playing quiz tournaments on the Incus quiz app, and you become more motivated by knowing how others are doing, how I am doing, how I can improve. And you can add audio comments, video comments, and make your preparation fully rich, right? So esophagus has 3 anatomical constrictions. The first is at the junction of the pharynx, pharyngoesophageal junction. The second, whenever the aortic arch and the left main bronchus is crossing. Third is whenever it is finally joining the stomach. So you should be very sure, if you calculate from incisors, how far these constrictions are located. I'm really so happy to see 46 online students. What happened to you all guys? Probably what happened to me. Because I was sitting with the technology guys to build the Incus quiz app, I could not get the time all the days. Now that the exam is postponed, we got a solid 1 more 100 days of time. Let us work together and make it happen. Now, constriction of the esophagus. Left main bronchus, left atrium, diaphragm, they are all the classical locations. So if you look at the heart, anterior to posterior, always right atrium, right ventricle. Let us say this is the sternum, is anterior. Left atrium, left ventricle is posterior. That's the reason whenever mitral stenosis is there, whenever the left atrial enlargement is there, whenever mitral regurgitation and mitral stenosis, that lead to the compression of the esophagus, leading to the development of dysphagia as a presenting feature is what you need to remember. These are all the structures that press on the esophagus. Aortic arch, left atrium, left bronchus, any of them can press on esophagus because they're all in close relation to the esophagus in the mediastinum. Absolutely, Anjana Krishnan reminds Bedford sign, right? Very good. Absolutely, Asra Khan. I'm so happy to see the number 50 watching now. Excellent. Please do come. Asra Khan compliments saying, thank you, sir. Sustaining motivation is bigger task than studying. Absolutely, doctor. Absolutely. जब हम पढ़े तो जोश में पढ़ना है, मोहब्बत करे तो जोश में करना है, वैसा ही एवरीथिंग कितना जोश में है, how much kick we take in every act passionately makes all the difference of this human life. So you have a most senior classmate like me who love to prepare every day. Once more I am feeling like first year anatomy student to sit with all of you and prepare. आप और 50 को लाना, रोज 100 टच करे तो I promise that at least 3 to 4 hours we will spend in discussing the subject and doing the revision. Free on the YouTube, that's a promise. But you all download the Incus quiz app, subscribe, just 600 rupees per month, and you have 20,000 MCQs available for you to play as 1,000 quiz tournaments. And after the tournament, every question, it opens up with an explanation and for everyone to comment and post audio, video comments for every question. That brings a lot of discussion, right? Now, renal angle, where do you get it? That's called renal punch. Typically, the renal angle is between the 12th rib and the erector spinae. So, between the lower border of the 12th rib, you are able to see here, doctor, 12th rib. Very good. So, keep punching your answers, doctor. 12th rib and the lateral border of the erector spinae muscle. Typically, you have the renal angle where there is a renal colli is what you have to emphatically remember. The right border, the left border of the heart is a favorite question. Come on. Punch your answers, doctor. Let us see who is going to give me the correct answer. Good to see Dr. Manali Gaur, Bharathi, Satyendra. Excellent, excellent. So, Aline is answering B. Smriti is thinking C. Computer Mahoday, lock kiya jaye. So, you should remember the borders, doctor. Very clearly. Superior vena cava. Superior vena cava, ascending aorta, right atrium, atrial appendage, they are all the right side. Arch of aorta, pulmonary artery. Whenever pulmonary hypertension is there, typically there is a straightening of this left border because pulmonary artery no more is concave but became convex. Here you have the left atrial appendage, but when left atrium enlarges, it doesn't enlarge to left side, it enlarges towards the right side. And that is called shadow within shadow appearance is what you need to remember. And the left ventricle typically forms the left border is what you need to remember. So this is the ascending aorta, pulmonary outflow tract and the right ventricle. So all right atrium, right ventricle, pulmonary outflow tract, they're all underneath the sternum. And posteriorly you have the left atrium, right atrium and IVC. That's what you're able to see. Some of you are going to be top interventional cardiologists in the times ahead. So you should be very sure. So arch of aorta, pulmonary trunk, left auricle, left ventricle, left side. SVC, right atrium, IVC on the right side. Emphatically, you should remember. So the left border is formed by the arch of the aorta, pulmonary trunk, left auricle, left ventricle, and extra pericardial fat. is what you should understand. The pleural reflection. Punch your answers, doctor. The pleural reflection on the left mid-axillary line is up to which intercostal space? Always, what are the anatomical landmarks of the pleura? And 2 spaces above, you have the lung. ये दोनों फेवरेट क्वेश्चंस होता है एग्जामिनर के लिए. So, doctor, the pleural reflection typically in the mid-axillary line is up to the 8th intercostal space. So you should remember the lower border of the pleura crosses 8th rib in mid-clavicular line, 10th rib in mid-axillary line, 12th rib adjacent to vertebral column. Whereas the lung will be 2 spaces above. 6th in mid-clavicular line, 8th in mid-axillary line, and 10th adjacent to vertebral column is what you need to remember. So, मेरे प्यारे देशवासियों, हम पहुंचा end of the first topic, which is the anatomical landmarks. So now you understood what is the significance, what are the things to mug, to by heart in the first topic. Like this, there are 900 topics, 900 high yield topics, 953 precisely, high yield topics. You need to know on each of this topic at least 20 points. Pura milaye to 20,000 points is all that you need to master to become the topper in NEET PG. इसलिए मेरे प्यारे भारतवासियों, Incus क्विज ऐप डाउनलोड करना, वहां NEET PG कैटेगरी को जाना, 600 rupees सब्सक्रिप्शन फी पर मंथ, very cheap, and you get an opportunity to play these 20,000 MCQs as 1,000 quiz tournaments, know how everyone in the world is performing, and then go to the history and review each question with explanation. And you also add your comments, your point of explanation, both audio, video. Just like TikTok, you can be able to shoot a video and teach everybody in the world 2-3 points about every question. That's how it is a powerful medium, Incus quiz app. So take every opportunity. Now, the next topic is cartilage types. Elastic cartilage, where do you find? Come on, punch your answers, doctor. Elastic cartilage, where do you find? Let me check how much you are all awake. Yes. Where is elastic cartilage, doctor? Anjana, Krishnan, Bharathi, Muhammad, Umar, Manali, everyone is presenting, proposing auricular cartilage. Absolutely. अच्छा भैया, कोई निमोनिक है क्या इसको याद रखने के लिए? E, remember E for elastic. E होता है epiglottis, E होता है ear का पिन्ना, E होता है external acoustic meatus lateral part. E is eustachian tube's medial part. Eustachian tube का medial part. External acoustic meatus का lateral part is elastic cartilage. बराबर? फुटवा ले लिया इस स्लाइड का, very important. Now, once more, which is found of elastic cartilage? Auditory tube. Ear lobule is made up of elastic cartilage, which is a hyaline cartilage. Come on. Punch your answers, doctor. Punch your answers, which is an example of hyaline cartilage. Punch your answer. Akram, is proposing tip of nose. Manali, arytenoid cartilage. Everyone else is betting on tip of nose. Tip of the nose. Manali, one quick correction before we find Dr. Manali Gaur becoming the topper of Himachal Pradesh NEET PG quota. You are from which part of the country, Dr. Manali? So, blanket, you remember, for hyaline cartilage. Don't tell Murali Bharadwaz teach like this. But ultimately, the role of a teacher is nothing to teach. He should become a student everywhere. Very good. You are from Delhi. Good. So, the role of the teacher is to sit with the students, study along with them. So, B for bronchial cartilage, L for laryngeal cartilage, A for articular cartilage, N for nose, C for costal, E for embryonic cartilage, T for tracheal. ये सब होता है hyaline cartilage is what you should remember. Which is an example of hyaline cartilage, thyroid. So hyaline cartilage forms the articular surface of the bones. Thyroid cartilage, cricoid, arytenoid, carniculate, cuneiform, they're all composed of hyaline cartilage. But the epiglottis, जो होता है, epiglottis is elastic cartilage. And there is no fibrocartilage in larynx. That is what you need to remember. Synovial joints, articular surface. If you do the examination, what cartilage is it? It is hyaline cartilage. A white fibrocartilage हर जगह पे होता है except, you should remember, except pinna. Meniscus, intervertebral disc, acetabular labrum. You have the white fibrocartilage. So the fibrous cartilage has a lot of collagen fibers, and it is found in the intervertebral disc and the pubic symphysis is what I want to underscore to all of you. The pinna, just before E for ear, E for elastic cartilage is what you have to remember. Intervertebral disc is an example of what? It is an example of fibrocartilage is what you have to ultimately remember. So, Bhaiya, now you know what is topic number 2, which is the favorite topic of the examiner. Hota hai cartilage. They still have energy. और 2 topics खत्म करके आज की चाय पे चर्चा खत्म करेंगे. Do you still have energy, or shall we take it up a little later? Your choice, my opportunity, that's all. Do you still have energy? We play a bit about inguinal canal. Today, serious topic hai Babuji. Inguinal canal. Very good. All right. So, doctor, I still remember as a undergraduate student, when as an undergraduate student, I was from Telugu medium, a local vernacular medium. बड़े बड़े मोटा मोटा ग्रेस एनाटॉमी, गाइटन फिजियोलॉजी डर लगते, उसको पढ़ना भी नहीं आते. So nobody used to tell how precisely is the inguinal canal. Of course, without precisely knowing only, we finished many subjects in MBBS. Ophthalmology, ENT के लिए white part is cornea, transparent part is conjunctiva, and the black part is uvea. if you know that, more than enough. Examiner will say you are passed. Inguinal canal is also a topic like that. So I want to make you all experts in this topic called inguinal canal. जरा पेशेंस के साथ मेरे साथ काम करें तो आप भी inguinal canal में एक्सपर्ट बनोगे. What are the boundaries of inguinal canal? Except पर्दे के पीछे क्या है? Fascia transversalis is posterior boundary. Inguinal ligament forms the base. Internal oblique forms the roof. They're all the true statements. Conjoined tendon पर्दे के पीछे नहीं रहता. I mean, पीछे रहता, anterior नहीं रहता. So that is important. अच्छा भैया, this is the best illustration I ever liked to teach. Three-dimensional view of inguinal canal आपके दिमाग में बैठ गए तो कुछ भी टेंशन नहीं है कल के एग्जाम के लिए. Roof. Imagine this is the right-sided inguinal canal. Lateral aspect, medial aspect. एक आदमी का right side है, यहाँ left side है. Right side का inguinal canal के बारे में हम बात कर रहे हैं. It has one anterior wall, it has a roof, it has got a floor, it has a posterior wall, medial aspect, lateral aspect. Barabar? So now, if you look at the posterior wall, I'm talking about behind. There is a deep inguinal ring which is situated along the lateral aspect of posterior wall. Posterior wall के lateral aspect में रहता है deep inguinal ring. बराबर? बराबर. Here you have removed the roof, you have removed the anterior wall. खाली floor दिख रहा है और posterior wall दिख रहा है. Posterior wall के lateral aspect में भैया, क्योंकि ये क्या है? Right sided inguinal canal. बराबर? Now, in the anterior wall, you have a superficial inguinal ring which is situated more medial. Posterior wall के lateral aspect से anterior wall के medial aspect को spermatic cord will pass is what you need to remember. So the spermatic cord enters the inguinal canal through the deep inguinal ring. Where is it located? Lateral aspect of the posterior wall, and it passes on the floor and enters and leaves out through the superficial inguinal ring, which is located in the medial aspect of the anterior wall. समझ में आ गए ना? एनाटॉमी में कोई पढ़ाएगा नहीं इंगुइनल कैनाल के बारे में. सर्जरी प्रोफेसर सोचेगा कि भैया ये लोग एनाटॉमी में पढ़ लिया ना, इसलिए मैं कुछ बोलने की जरूरत नहीं है. So the fear of inguinal canal, which starts in anatomy, will remain forever and prevents to even enjoy the topic of hernia when we are in surgery. That is the sad part. But not after today. Today you are going to be champions in inguinal canal. Acha, how is this anterior wall? Anterior wall is formed. There is external oblique muscle throughout the anterior wall. Additionally, internal oblique muscle reinforce it laterally. Right? So, entire anterior wall is because of what? By the external oblique muscle. There's a little reinforcement laterally by the internal oblique muscle laterally. And the transverse abdominis muscle also contributes. Even more laterally transverse abdominis muscle also is supporting the anterior wall. So अभी anterior wall को बोलो और एक बार बोलो मेरे साथ बोलो. Anterior wall external oblique throughout and lateral aspect internal oblique, a little more lateral aspect transverse abdominis muscle. These three are anterior wall. Barabar? Now, if you look at the conjoint tendon, Shivani Tripathi is saying, sir, when is the NEET PG now? Please tell the date. Good question. According to the Neglis rule, 9 months plus 7 days is normal. अभी थोड़ा कोरोना के वजह से नीट पीजी obstructed leg पर हो गया बेटा, इसलिए थोड़ा पूरा दुनिया साइलेंट होने के बाद examiner want to declare maximum another 2 months, March, April, definitely. Because postgraduate should come, otherwise how will medical colleges and hospitals can work? They can't. So इसलिए नेक्स्ट कब होगा, जिंदगी के बाद क्या होगा, मरने के बाद क्या होगा, they are all hypothetical questions. So don't worry, there is a life after death, definitely. इसलिए जरा कम से कम डर के वजह से heaven and hell, we will try to do good things. Similarly, दिसंबर के बाद जनवरी आएगा, जनवरी के बाद फरवरी आएगा, फरवरी के बाद मार्च आएगा. Any day the exam will be there, but you are getting some extra time. That's what I like to tell you. So doctor, the conjoint tendon attaches to the pubic crest medially. It reinforces the posterior wall and also forms the roof of the canal. That is the importance of conjoint tendon. So how is conjoint tendon formed? Two muscles. One is transverse abdominis and internal oblique. Right? Forms the conjoint tendon is what you need to remember. So doctor, the posterior wall, how is it formed? The posterior wall, how is it formed? You have a deep inguinal ring posteriorly, laterally, conjoint tendon medially. So the posterior wall is formed by the transversalis fascia, which is typically present throughout, just like external oblique is present throughout the anterior wall, transversalis fascia throughout the posterior wall. Conjoint tendon will reinforce it medially, but laterally, because there is a hole, posterior wall is weakest laterally, anterior wall weakest medially because of the superficial inguinal ring. That is what you need to remember. Tim's 89 is saying, is this a medical class? No, sir. This is gynecology class. Psychiatric class, maybe. More appropriate to say. Sir, list of important topics, please. मिल जाएगा, क्यों नहीं? As per, please give a call to 9000-868-356. Okay, doctor. You will get the PDF of it. So no worries. So how is the floor formed? Floor is formed by the incurving of the inguinal ligament. And which is the part of the external oblique muscle forming a gutter. Medially, there is a lacunar ligament, which is the part of the floor, is what you need to remember. So, roof is formed by conjoint tendon and the meeting of the anterior and posterior walls of the canal. And the anterior wall of the canal is formed by the external oblique muscle throughout and internal oblique muscle laterally reinforcing it. That is what you need to remember. So, how does herniation occur? Herniation occur because some weak point should be there through which the hernia should occur. So, any increased abdominal pressure, typically the anterior wall is reinforced by the internal oblique muscle laterally, and conjoint tendon is reinforcing the posterior wall medially. So, this medial aspect of the anterior wall where the superficial inguinal ring is there, that is the weakest, is what you have to appreciate. So now one of the favorite MCQ tomorrow when you go to the surgery doctor is, whenever there is an indirect hernia, और एक confusion की बात है, भैया indirect क्या होता है? Agar herniation is occurring through the inguinal canal and it is coming out to the superficial inguinal ring, that is called indirect. And if the herniation is not occurring through the inguinal canal, उसको बोलते हैं direct. बराबर? तो इसलिए indirect hernia when it is happening through the inguinal canal, what are its coverings? You have the peritoneum, you have the internal spermatic fascia from transversalis fascia, you have the cremaster muscle and fascia from the transverse abdominis and internal oblique muscle, and you have the external spermatic fascia from the external oblique muscle, superficial fascia, the skin. They are the parts of the coverings of the internal indirect inguinal hernia. This is the favorite super hot MCQ, doctor. Be very sure. The second super hot MCQ, जो आपके मन में दिल में रहना है, coverings of the direct hernia. Peritoneum, transversalis fascia, conjoint tendon, external oblique aponeurosis, superficial fascia, and the skin is what you need to remember. So now what are the boundaries of the inguinal canal? You remember MALT, 2 M's, 2 A's, 2 L's, 2 T's. Let us check. If you start from superior moving around in the order to posterior, what do you have? Superior wall, roof जो है, roof, परमपिता परमात्मा ऊपर कौन है? Roof. So what does the roof contain? Roof has 2 muscles. क्या muscles हैं? Internal oblique, transverse abdominis. Anterior wall has 2 aponeuroses. You remember MALT, aponeurosis of external oblique muscle, then aponeurosis of internal oblique muscle, anterior wall. Floor को क्या बोलते हैं आप? Floor को बोलते हैं, what do you call floor? 1 minute. The floor is also called lower wall. You can remember there are 2 ligaments. Floor, inguinal ligament, lacunar ligament. Posterior wall is 2 T's, transversalis fascia and conjointed tendon. So MALT, 2 muscles, 2 aponeurosis, 2 ligaments, and 2 T's in the posterior wall. Will you remember? Absolutely, sir. Now, what is true about inguinal canal? यहाँ से सब कुछ खेल. Everything is a game if you got the concepts. Punch will answer, doctor. Question number 27. Let me see how many of you have have mastered this topic once for all. If you answer wrong now, I will cry. Come on, punch. Satyendra Singh, Manali Gaur. Very good. They both are betting on D, option D. Come on, come on. Anybody else? Good to see 43, 47 online. Tomorrow you should bring another 50. We should cross 100 number, भैया. आप 100 number मुझे promise करो. मैं रोज 3-4 sessions आपके साथ बैठ के पढ़ाई करूंगा. Guru Prasad is proposing D. Very good. Excellent, doctor. So, the medial part of the floor is formed by the lacunar ligament. Absolutely right. Posterior wall of the inguinal canal is formed by all except. You have the parietal peritoneum fascia transversalis throughout. That forms the posterior wall of the inguinal ligament. Contents of the spermatic cord क्या होता है? Vas deferens, cremastic artery, genital branch of genitofemoral, they are all the contents. So what is the mnemonic for spermatic cord contents, doctor? ऐसे टॉपिक है inguinal canal, अकेले बैठ के रिवीजन करना बोले तो बहुत बोरिंग लगता है. मिलके साथ मिलके पढ़े तो मजे में पढ़ सकते. रूल ऑफ थ्रीज, 3 arteries, 3 veins, 3 nerves. फिर मेरे साथ बोलो 3 arteries of spermatic cord. Testicular artery, cremasteric artery, artery to vas, 3 arteries. 3 veins, pampiniform plexus, cremasteric vein, vein of vas, 3 veins. 3 nerves, genital branch of genitofemoral nerve, sympathetics, ilioinguinal nerve. But ilioinguinal nerve runs outside the spermatic cord. So you can't say that it is a content of it. That's what exactly is asked in this question. Ilioinguinal nerve जो होता है spermatic cord के बाहर is what you need to remember. 3 fascias. Exospermatic fascia, cremasteric fascia, interspermatic fascia, and 3 other structures. Vas deferens, lymphatics, and tunica vaginalis is what you need to remember. So, doctor, whenever the spermatic cord is passing at different places, different things be part of it. So, the vas artery of vas, testicular artery, which is the branch of aorta, cremasteric artery, the branch of inferior epigastric, cremasteric vein, the branch of inferior epigastric vein, testicular vein that goes and drains into the IVC on the right side and left renal vein on the left side, and process vaginalis, obliterated part, lymphatic, sympathetics, and genital branch of the genitofemoral nerve. They constitute the contents deep via the deep inguinal vein. एक बार कैनाल में आने के बाद ये सब रहता है. इसके साथ interspermatic fascia, cremastic fascia, cremastic muscle, ilioinguinal nerve. Of course, it runs outside the cord. Once it leaves the superficial inguinal ring, exospermatic fascia also will be wrapping around it. Do you remember this perfectly? If at all one question examiner is going to put knife and ask you at gunpoint, this is a very important table. So, पढ़ने के लिए the things are not unlimited. Please don't think that the amount of database of knowledge we need to have to crack the NEET PG is unlimited. No, not at all, not at all, not at all. If it were to be unlimited, doctor, how are our friends cracking the exam? हमारे साथियों को ही मिल रहा है ना top 1000 ranks में. If the knowledge were to be unlimited, हम हमारे roommate who is otherwise a mediocre, how is he cracking the top rank? So the secret is not about knowing unlimited things in NEET PG. The secret is all about 20,000 points, sharp points. उसमें फैक्चुअल पॉइंट्स रहता है एक 10,000. एक्सोलॉन्ट्री कैनाल का लेंथ क्या है, यूरेटर का लेंथ क्या है, राइट? व्हाट इज द रूट वैल्यू? बकवास. बट यू हैव टू रिमेंबर 10,000 आर मग 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 मग. देन लिस्ट रहता है. P450 inducers, what are they? P450 inhibitors, what are they? What are the 10 side effects of Amitriptyline? You have to remember, there's no other way. Lists. Then comes 3,000 to 4,000 logical points. Diabetes insipidus is a diuretic condition. फिर भी उसमें thiazide का इस्तेमाल करते हैं. क्यों? There's a reason for that. Thiazide is a diuretic. Still you will use it in diabetes insipidus, which is a diuretic condition. There's a reason for that. Which type of renal tubular acidosis do you have? Nephrocalcinosis. Why only in one type, not in other? There's a reason for that. So all these logical things, 4,000-5,000 रहता है. पूरा 20,000 जब आपके काबू में आएगा, that is the moment, the wow moment, the moment of all that ultimate academic orgasm. You are the topper. Even before exam only, you will be knowing that I am going to be the topper. Exam लिखने के बाद, oh mummy, I could not get, my rank is very big, so many zeros. After my rank, I thought it should be at least 200, if not 2,000 decently. But 2 के बाद 0, 0, 0, 0, 0, 0 चल रहा है. Actually, we cry, we say we are panicked, we are depressed. Pura bakwas hai. Before going to exam only, we know very well that how good we are to become pregnant. So that's the reason there is nothing crying about, oh my God, I never thought that my rank will be so big, right? So इसलिए मेरे साथियों, 20,000 points. Incus quiz app. Today only you download it. Play quizzes, tournaments. Know how your classmates are performing. Then you go back to the history, check each question, give audio, video comments, and see others commenting. And whenever you play a game, whenever anybody else comments, you will get a notification that somebody commented on the question that you have played. So that way, there's a lot of reinforcement that happens. All for a small price of 600 rupees subscription per month. You get the 20,000 question bank to do the quiz tournament practice with explanatory answers, community of friends, etc., etc. So the whole idea is be motivated throughout the day, across the day, and be optimistic, incurably optimistic. Even before the world can see the topper, you have to see the topper in yourself. That is the most important thing. Once you believe yourself, automatically you don't need any other person to validate that. The entrance results themselves will validate that. But पहला ख्वाब आपके मन में शुरू होना है. You should see the dream of you becoming a top cardiothoracic surgeon or a neurologist or a dermatologist, radiologist, psychiatrist, etc., etc. Few more questions on the inguinal canal, doctor, and then we will call it a day. A great beginning. So, what layer does the external oblique aponeurosis contribute to the spermatic cord, external spermatic fascia? What pair of components do the internal oblique muscle and its fascia contribute to spermatic cord? Cremasteric muscle and fascia. So Manali is asking a question, sir, tomorrow what topic? Once more, we will continue anatomy. There are 56 topics in anatomy. I'm going to finish revision in about 10 hours. These 56 topics. And every day I try to spend a couple of hours with you, either morning, evening, afternoon, whenever I get the time. So please be subscribed to this YouTube channel. Also share it with your friends. Cremasteric muscle and fascia. So they contribute to the spermatic cord. Which layer does transversalis fascia of the abdominal wall contribute to spermatic cord? Internal spermatic fascia. Now, doctor, Hesselbach's triangle, how is it formed? This is a very interesting question. Come on, punch your answers, doctor. Hesselbach's triangle is formed by, what are the boundaries of Hesselbach's triangle? Punch your answer, doc. Bharathy is betting on medial border of pyramidalis, except, okay, Satyendra Singh also, absolutely, doctor. So you should remember, the Hesselbach's triangle and its boundaries. Medial border is the lateral margin of the rectus sheath and linea. This is the rectus muscle, doctor. So the medial border is formed by the rectus abdominis muscle in its sheath. Inferior epigastric vessels form superolateral margin. And inferior border is formed by the inguinal canal. Remember? That is what you need to remember. So this is how the Hesselbach's triangle, medial border, rectus, inferior epigastric artery, superolateral, and inferior formed by the external oblique epineurons. So this is a normal patient, doctor. These are all the abdominal musculature. So if you understand, you will be able to remember forever. This is epigastric vessel, and you can see the inguinal canal here. If there is an indirect inguinal hernia, it will pass lateral. This is lateral, this is medial. Lateral to the epigastric vessel and enters into the inguinal canal. Whereas the direct inguinal hernia directly opens into the abdominal wall, and hence it is medial to the inferior epigastric vessel is what you have to remember. So the direct inguinal hernia enters to the medial half of the weak posterior wall and becomes superficial through the superficial inguinal ring. That is what you need to remember. So the medial border of the Hesselbach's triangle, linea semilunaris, is what you need to remember. So which structure does not pass through the inguinal canal in female? So ilioinguinal nerve, round ligament, remnant of process vaginalis, they all pass through the inguinal canal in female, but not inferior epigastric artery. So to be very sure, you have the deep ring, then superficial inguinal ring. You can see cremaster muscle, external spermatic fascia, interspermatic fascia, tunica vaginalis, parietal and visceral layers. So, doctor, contents of inguinal canal is the favorite topic of the examiner. Spermatic cord in the males. So, vas difference, artery to vas, sympathetic plexus around the artery to vas, testicular and cremasteric artery, genital branch of genitofemoral nerve, pampiniform plexus, they are all the spermatic cord contents. Obviously, when spermatic cord is passing to the inguinal canal, they are also passing. The remains of process vaginalis. In few people, it remains patent. Patent process vaginalis is responsible for the hydrocele. Then the round ligament of uterus in case of the female. The artery and vein of the round ligament, genital branch of genitofemoral nerve, they're all the contents. Then the ilioinguinal nerve is also the content of the inguinal canal, but it is outside the spermatic cord. And vestigial remnant of process vaginalis sac. Now comes the question, doctor. All this pass through the deep inguinal ring, except, so you should remember, round ligament, interspermatic fascia, spermatic cord, but not ilioinguinal nerve. Ilioinguinal nerve does not pass through deep inguinal ring. So that is the reason the spermatic cord, everything comes to the deep inguinal ring along the lateral aspect of the posterior wall and leave to the medial aspect of the anterior wall to the superficial inguinal ring. That's what we read, right? So ilioinguinal nerve does not come through the deep inguinal ring. That is what you need to emphatically remember. So ilioinguinal nerve is being shown in the inguinal canal after it has emerged from the deep inguinal ring, is what you need to remember. So that is all the story, doctor. When we talked about the inguinal canal, there's one more topic called root value. Still, do you have energy? I can. Otherwise, you say, sir, we will take this topic. कल करेंगे बोले तो कल करेंगे, आज करेंगे बोले तो आज करेंगे, क्योंकि हमको कुछ भी काम नहीं है, यही काम आता है आपके साथ. Proposing continue. Okay. Last topic before we call it a day. So I'm really happy to see all of you after a long time. Suddenly I thought Dr. Murali Bharadwaz, who ruled 2 decades of the empire of postgraduate medical entrance coaching, I thought maybe I'm not that relevant in the modern time where every chapter there are people, there are teachers now. There are some coaching centers which offer हर एक chapter के लिए एक teacher को present करेगा. So I thought maybe I only teaching. Once upon a time there used to be nobody to teach, so that's how I got into the habit 20 years back to teach all 19 subjects. So I was thinking maybe am I still relevant? So today 55 of you attending this session has reinforced a great joy in me that I'm back with all my students who are preparing for exam. And now, fortunately, Corona has given us an opportunity to restart, relook, and another 100 days of time is being given. So, doctor, let's take up this last topic for today's evening. The root value of tendocalcaneus reflex. Who is going to give me the answer? Keep punching, doctor. Keep punching your answers. Root value of tendocalcaneus reflex. S1, S2. A purely batti marne wala topic hai, doctor. There is no other way. Ankle jerk, S1, S2. Knee jerk, L3, L4. Biceps, C5, C6. Triceps, C7, C8. You have to be 100% sure. So you can remember 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, ankle jerk. 3, 4, knee jerk. 5, 6, bicep. 7, 8, triceps. That is what you need to emphatically remember. Some of you are going to be general medicine MD like Dr. Murali Bharadwaz shortly. You are going to recite this. So when they say shrug the shoulders and say, I can't help you, dear, that becomes C4. You bend your elbow, that is C5. You pull your wrist back, C6. You straighten your arm, C7. You open and close your fingers, C8. Ramaya, spread your fingers, P1. Ramaya, flex your leg at the hip, L1, L2. Ramaya, straighten your knee, L3. Ramaya, pull your foot up, L4. Push your foot down, L5, S1. So neurological examination is like a tailor's job, carpenter's job, mathematician's job. It's just like you touch here, you click here, you hit here, and then you will be assessing where is the level of the neurological lesion. So doctor, when you ask the patient, Ramaya, to make his knee with the leg backwards, L5, S1, forward, L3, L4, hip, L4, L5, backward, L2, L3, hip forward. Eversion is L4, inversion is L5, S1. Always remember, doctor, you look at your foot, all of you look at your foot, little toe, kaha rehta, lateral rehta. Foot mein big toe will be medial, little toe is lateral. Little hota hai chotu, S1. So all the cutaneous innervation along the lateral aspect of your foot is S1. All the cutaneous innervation of the medial aspect of your foot where your big toe, big is L5. That's one. So L5, S1 inversion, L4 is eversion. That's what you need to remember. So plantiflexion, dorsiflexion, L4, L5, S1, S2. So once more, doctor, how do you judge the power of muscles? No movement, limb muscle, trace of contraction, 1/5, active movement when gravity eliminated, 2/5, against the gravity, 3/5, against the resistance, 4/5, thappad mare to normal strength. That is what you need to remember. So these are the things like a religiously, you need to remember it, doctor. Whatever, I'm so happy to see 64 online. Please bring your friends. Don't forget to mark a notification of the YouTube so that every time I come online, you get a notification, right? Whenever we host a session. Also, don't forget Incus quiz app. Tonight only you download and register 20,000 questions as 1,000 quiz tournaments for you to practice. After practice, we will give you deep analytics. What are your strong topics, weak topics, how you are faring in comparison to your friends, what questions you can bookmark to do the last revision. And questions are accompanied by explanatory answers. And you can also start adding audio comments, video comments, image-based comments. You write a handwritten notes and add the comment, handwritten note comment also, right? So biceps is C5, C6, triceps is C7, 8. Brachioradial is C5, C6. Patellar is L2, 4. HL is L5, S2. Plantar reflex is L4, S2. And abdominal reflex. Upper is T8 to T10, lower is T10 to T12. Very important. Favorably asked. Cremasteric reflex, L1 to L2 is what you need to remember. Oh my God. This is the mother of all high-yield topics for the entrance exam. Whether you go to USMLE, PLAB, अफ्रीका, अरेबिया, कहीं भी जाओ ब्लैडर के साथ जाना पड़ता है. ब्लैडर का इनर्वेशन क्या है? दिस इज मोस्ट इंपॉर्टेंट टॉपिक दैट यू नीड टू मास्टर, डॉक्टर. If you are Dr. Murali Bharadwaz students, your bladder should be strong. Now tell me. Punch your answer, doctor. Very good. Most of you are punching D. Amit Jadhav, Sayeda, Manali are betting on C. अच्छा, देखेंगे. Computer महोदय बोलता है कि ये, that's important. L1 and L2. So that is very important, doctor. So एक मर्तबा आप ये 20,000 क्वेश्चंस ऑन इंकस क्विज ऐप टूर्नामेंट के मोड में खेलो. 20 क्वेश्चंस आर वन टूर्नामेंट. एक मर्तबा आप खेलने के बाद we are adding a tab called rights, wrongs. What are the questions that you answered right? What are the questions you answered wrong? आपके रॉन्ग किए हुए आंसर्स पूरा एक जगह पे आते हैं. नॉट ओनली दैट क्वेश्चन यू आंसर्ड रॉन्ग, हाउ मेनी आंसर्ड राइट भी हम स्टैटिस्टिक्स दे देंगे, ताकि अरे इतने लोग राइट कर रहे हैं, 80% मैं खाली रॉन्ग किया, ओ अच्छा नहीं है, इसको पढ़ना है. सो दैट इज व्हाट you should know, the starting point where you need to improve, right? So we are adding a feature called rights and wrongs. Every quiz tournament on Incus quiz app has got a pin number. You can tell your friend, भाई हम दोनों सेम गेम खेलेंगे, चलो. तो उनको पिन नंबर शेयर करो और वो भी खेलेगा, आप भी खेलो. दोनों के हिस्ट्री में आएगा वो पर्टिकुलर 20 questions. After you finish playing, then you both can be able to discuss. You can write a comment, he can see the comment, he can write a comment, you can see his comment under every question that you play. So that is the beauty part of Incus quiz tournamenting app. You play, we make you learn. You play, we will decide what are your learning gaps, where are your weak areas. You play, we will make you the topper. That is the promise of Incus quiz app. So take every opportunity to download. So doctor, ये ब्लैडर जो होता है, इसको parasympathetic, sympathetic, both of them will innervate. T10, T11, T12, L1, L2, thoracolumbar outflow. Thoracolumbar outflow is sympathetic. Craniosacral outflow is parasympathetic. Craniosacral outflow. Why? S2, S3, S4 are all parasympathetic. Why craniosacral? Why do you call craniosacral when it comes to parasympathetic? Because vagus carries the parasympathetic innervation, cranial nerve. Barabar? Similarly, facial nerve has got parasympathetic fibers carrying. So, always parasympathetic flows from cranium and sacrum. Sympathetic is thoracolumbar. That's what you need to remember. So, the sympathetic form hypogastric ganglion. And the hypogastric ganglion in turn supplies the detrusor and also supplies the internal urethral sphincter. And what happens when the sympathetic stimulation happens? It will make the bladder relax and the internal urethral sphincter also to relax. Then it will make the internal urethral sphincter to constrict. Then what is the story with parasympathetic? Parasympathetic comes to pelvic ganglia, from there nervi irrigantis. It goes and supplies the detrusor and it also supplies the internal urethral sphincter. So whenever the parasympathetic stimulates, the bladder become contracted, detrusor contraction occur. Internal urethral sphincter relaxes, and that makes the person to micturate. So parasympathetic helps to micturate, sympathetic helps to contain the urine. So अगर आप कभी organophospher poisoning patient को एट्रोपिन दिए तो क्या होता? Atropine is parasympatholytic. Parasympatholytic. Normally, parasympathetic will go and contract the bladder and relax the sphincter. If you do parasympatholytic by giving atropine water, what will happen? The internal urethral sphincter becomes spasmodic instead of relaxed, and the bladder will go into relaxation if you give atropine. इसलिए एट्रोपिन देने के पहले ही आप फोली कैथेटर डालना. अगर फोली कैथेटर डालना भूल गए और एट्रोपिन दम जमाए तो क्या होता? इंटरनल यूरेथ्रल स्फिंक्टर स्पैस्मोडिक हो जाता. अगर आप कैथेटर पास करना बोले तो बहुत टाइट हो जाता. That is very important point. Okay, so summarize, doctor. T10, T11, T12, L1, L2, sympathetic, which typically relaxes the bladder, constricts the sphincter. S2, S3, S4 is parasympathetic, goes to pelvic ganglia, nervi erigantis. It contracts the bladder and relaxes the sphincter, is what you need to remember. Then comes external urethral sphincter. भैया ये voluntary है. Voluntary है. So in MBBS exam days, what we used to do, नक्कल मारने के लिए पूरे 84 का पेजेस को काट के पैंट में लगा के क्वेश्चंस को देख के, ma'am, I want to go to washroom. We used to go to washroom, quickly do a early reference, throw the papers, come back, और लिख लेते. So that used to be a regular secret in the medical college, how to pass exams, nakkal mark. So external urethral sphincter used to help. So that voluntary. So who controls that? That is the pudendal nerve. Is the somatic control. S2, S3, S4. Typically, pudendal nerve is the one which controls external urethral sphincter. So you're not going to forget this, doctor. One of the favorite questions of the examiner. The skin over the angle of mandible. Very important. The skin everywhere on the face is by trigeminal, except that skin overlying the angle of mandible, which is supplied by the cervical spinal nerve, C2 to C3. Only area is the skin overlying angle of mandible. So that is what you need to remember. So the great auricular nerve forms the part of the cervical plexus. It comes from the second and third cervical spinal nerves, anterior primary rami, is what you need to remember. Klumpke's paralysis, lower or upper? Lower. Klumpke, K-L-U-M-P-K. So lower. CAT1 is what you need to remember. So whenever a person who is falling down happens to hold the tree, typical example where there is a clumkey. Whenever clumkey is there, the medial aspect of the arm, there is a loss of sensation. There's a paralysis of the small muscles of the arm leading to clawing, like ulnar nerve palsy. The lateral border of the foot, इसका आंसर निकलना है अभी. Come on, बताओ. Question number 38. If you answer this wrong, I'm going to cry. Lateral border, little finger. What is the answer? Falafat bolo. Manali, Anjana, Satyendra. What is your answer? Come on. Dr. Preeti. Excellent. S1. So you should remember big toe, big number L5, little toe, little finger S1. Root value of inferior gluteal nerve is L5, S1, S2 is what you need to remember. So you have a superior gluteal nerve, inferior gluteal nerve, S1, S2, S1, S2 is the inferior gluteal nerve. So superior gluteal nerve is L4, L5 and S1. Inferior gluteal nerve is L5 and S1 and S2. अच्छा भैया, इसका एक important point है. Gluteus medius minimus are by the superior, but gluteus maximus is by the inferior gluteal nerve. One of the favorite questions of the examiner. Erb's point. So what is Erb's point? C5, C6 is called Erb's point, which is the upper trunk of the brachial plexus is Erb's point. Cremasteric reflex is by the genitofemoral nerve, as all of you know very well. So it is the femoral branch of the genitofemoral nerve and ilioinguinal nerve form the afferent limb, and the genital branch of the genitofemoral nerve forms the efferent limb. This is what you need to remember. So this is one interesting question, doctor. Iliohypogastric nerve, L1, skin above the inguinal ligament. Ilioinguinal nerve, L1, skin of the anteroscrotum and anterior thigh, very erotic area. Genitofemoral nerve, L1, L2, skin below the inguinal ligament, and it is also motor to the cremaster, is what you have to remember. So what is the root value of phrenic nerve? C3 to C5 is phrenic nerve. So that brings us to the end of this wonderful journey we had, doctor. Once more, I like to request all of you, in fact, thankful to all of you to bring out a teacher out of me after a long time. We all met. You please visit Google Play Store, and there you have the Incus. टाइप करो और आपको मिलेगा कुंग फू पांडा, Incus मल्टीप्लेयर क्विज ऐप डाउनलोड करो, खेलो और रोज मुरली भरद्वाज के साथ पढ़ाई करो और just live in the dream. Forget about whatever the time that was yesterday. वो कभी भी न आएगा नहीं. कल क्या होगा हमको मालूम नहीं, जहां पर पूरा ऊपर वाले के हाथ में है. आज हमारे हाथ में है और मिलके मेहनत करेंगे, रिवीजन करेंगे और अचीव करके दुनिया को दिखाएंगे. Sure. Good night to everyone and see you all tomorrow and every day.